Hi, this is Stacy Pruitt, a student at United States University. Today I'm going to be discussing Ernest Codman. A couple of the topics that we'll be going over is who is Ernest Codman and what did Dr. Codman do to foster quality improvement. Ernest Codman was born on December 30th, 1869, and he died November 23rd, 1940. He is an American surgeon. He pioneered the use of process and outcome, or the end result is what he would refer to it as. He graduated from Harvard University, and that is also where he went to medical school. He contributed to the fields of radiology, anesthesiology, and surgery. In 1996, the Joint Commission established an award in his honor called the Ernest Armory Codman Award. During the time that he was alive, he often challenged other physicians in the act of taking patients just to increase their pockets or for monetary value more than caring for the patients or caring for improvement in the field. Process and outcomes measures, or the end result. The end result measures seem to be much of a cause and effect type of results. Observe a treatment being given to a patient and then see what the effects are to the patient. Was the treatment effective? If the treatment was not effective, then why was the treatment not effective? Providers today are still using Codman's ideas and keeping his ideas relevant. In research today, what do we typically do? We typically have a question and we try to find the answer to the question. Is this type of chemo working for this cancer patient? If it's not, then let's try an additional chemo or a different chemo. Same with any other type of medication. If you have a headache and you take Tylenol and the Tylenol hasn't helped, then the Tylenol didn't help your headache. You can take ibuprofen and then again reassess to see if the ibuprofen has helped with the headache. Process and efficacy. Before Dr. Codman was even out of medical school, he was already seeing the cause and effects of certain processes. In 1989, he started a yearly log of his bird hunting. He would record the number of shots fired, which would be considered the process, and he would record the number of birds that were killed, which would be considered the outcome or the end result, and then the rate of the birds killed versus the shots fired. So if he shot at 10 birds and only killed 5, then he would have 5 out of 10 efficacy. He was a part of the American College of Surgeons. He was actually the chair of the Committee of Hospital Standardization. This committee studied hospital outcomes or end results, and eventually this committee led to the creation of what we know today as the Joint Commission. Why is Ernest Codman our favorite and least favorite person in healthcare? Because he helped create the Joint Commission. I think everybody is aware of what the Joint Commission does and how it takes care of, how it monitors how the hospital is caring for patients. we'll go into a little bit more detail about the Joint Commission. Although the Joint Commission is exhausting with their demands, the question is, what would healthcare be without it? Would there be more spread of diseases if we ate and drank at the nurse's station? Probably yes. I use that example because it seems like anytime you talk about the Joint Commission or nurses not getting breaks or things like that, all that people comment on is what would be the worst that would happen if we had a drink at the nurse's station or we ate at the nurse's station. Well, if you think about what could happen, say you were eating a sandwich at the nurse's station and the person before you chose not to wash their hands after taking care of a patient with C. diff, and then came back to the nurse's station and touched your computer or touched the desk or touched the chair or the phone, and then you're sitting there putting food in your mouth with your hands while touching all those things that the previous person had already touched with exposed hands of C. diff. Therefore, you could potentially end up with C. diff. Obviously, a very low chance, but the Joint Commission has these ideas in place for a reason, because they've tested something out, and this was their outcome. The next one is, would you become sick if you took care of patients with communicable diseases without wearing a gown, gloves, mask, or by washing your hands? The answer is yes. Would the patient's safety be at risk without the Joint Commission? Again, the answer is yes. Love it or hate it, the Joint Commission keeps both the patient and the staff caring for the patient safer. The Joint Commission's the Ernest Amory Codman Award. The Ernest Amory Codman Award was presented by the Joint Commission to healthcare organizations for achievement in the use of process and outcomes measures to improve organization performance and ultimately the quality and safety of care provided to the public. Mr. Ernest Codman was also known as the father of outcome measures. The award has been in existence since 1996, which was well after Dr. Codman had passed away. The award is to showcase the effective use of performance measures. Here's an example of somebody receiving the Ernest Amory Codman Award and the headstone that is up on the wall in the museum of the Ernest Amory Codman Award. That is my presentation. Thank you for listening.